let's go ahead and get started. Good afternoon, everyone. Happy Friday. Thank you all for joining today's the July Congenital Heart Surgery Database Monthly Webinar. It is Friday. We finally made it. I hope everyone has had a great week. I know I am most certainly looking forward to the weekend. So I hope you all have had a great week so far. On the call today, we have from the STS myself, Leanne Jones, Database Manager for Congenital and Thoracic Databases, Carol Crone, Senior Clinical Manager for the STS National Databases, Emily Conrad, STS Senior Database Coordinator, Jane Hahn, Associate Director of Quality. From our IQVIA team, we have Melanie Bent, Joe Brower. We also have Jeanette Hanna, Michelle Choi. We have Jean Lysek. I believe that's all we have there from the IQVIA team. I'm going to run through today's agenda to get us started. First of all, I'll touch on a couple of quick housekeeping items. Then I'll turn things over to Emily to provide our IQVIA update. I'll provide a couple of STS updates, and then I'll turn things over to Melanie and Joe to provide the IQVIA update. And then we'll finish off today's webinar with the Q&A portion. And again, just a friendly reminder to please submit your questions via the Q&A function. Alrighty, for our housekeeping items, the July training manual has been updated and is posted out on the STS website. Again, just a friendly reminder that the STS does have the mentorship program available to assist our new data managers. You all will be hearing more from Addie Dolan in the coming months about the STS mentorship program that is offered, and we do encourage our data manager community to please take full advantage of this amazing program. If you are interested in becoming a mentor or mentee, we need both to make this a successful program. Please complete the database mentorship survey found out on the STS website. The survey can be accessed on the STS National Database webpage by clicking the Data Manager Education link under the Important Resources section. Also in August, STS will begin hosting quarterly new data manager webinars. These sessions will be beneficial for those new congenital heart data managers or perhaps data managers that are still fairly new within their role. We'll be discussing how to access resources available to data managers, how to use your software specs, your data specifications, the training manual. We'll also show you how to submit clinical questions. We'll go through understanding the data collection form, as well as numerous other topics. If you guys have any suggestions for items to be covered in the new data manager webinars, please feel free to email me directly with your ideas. I'm happy to get ideas from you. We want to make these new data manager webinars beneficial for you, so please feel free to share any ideas with us. And the dates for these new data managers webinars will be coming soon. Again, they will be held in August for the congenital database, starting in August. So we'll have more information about when these will be held coming soon. Also, another opportunity that we wanted to share with you all for education is through the STS Learning Center. The STS has launched a new Learning Center this month that provides a central location for our users to easily view webinars, complete e-learning modules, review relevant educational content, and to satisfy select components of maintenance of your certifications. Our new Learning Center offers improved navigation, functionality, as well as searchability. The STS Learning Center, it can be accessed from the STS homepage, and in the top blue banner up at the top of the page, just click on the link for Learning Center, and this will bring you to our STS Learning Center homepage. Within the Learning Center, I just wanted to point out, for example, STS offers on-demand webinars on a variety of topics. For example, you can see we have links to the STS Summer Series that's currently underway. We have links to CT surgery and the COVID crisis webinars, quality webinars, as well as a link to our data manager webinar page. So again, please be sure to check out the STS Learning page for additional information on programs offered by the STS. So we hope you check it out and let us know your thoughts. And we hope you get some beneficial information out of the STS Learning Center. Next, I'll turn things over to Emily Comrade, our STS Senior Coordinator for the STS National Databases, for our update on AQO. Emily?
Hi all, hope you're having a great Friday. I just wanted to let you know that abstract submission has been launched and registration is open. If you want to find information about both of these, you can go to our website. You can actually take a photo of this QR code here and it will forward you on to the AQO webpage. Just as an FYI, abstracts are due on Friday, August the 7th. And a preliminary agenda is up on the website, so you can take a look at the program that we are planning. And registration pricing, it is either you can register for 1 day of content for $150 for STS members, and if you're not a member, then it's $200. If you're involved with other databases and you want to watch all of the content for every day, it is $300 for STS members and $400 for non-members. A few topics that will be covered for the congenital content. We'll have both recorded content and live sessions. So some of the recorded content will be on adults with congenital heart disease, the Ross procedure, quality improvement. Live sessions will be things like covering the audit, high miss areas, common findings. We'll also cover the risk model, complications, and there'll be a What Data Managers Want to Know session that will cover pre-op factors, interoperative issues, procedure coding, diagnosis coding, and more. So again, everything's up on the website, and so feel free to take a look, and we hope to see you virtually at the conference. That's all.
Excellent. Thank you so much, Emily. And
yeah.
Go ahead, Emily. Go ahead.
Go ahead. Oh, and I was going to say, and hopefully next year we'll see you in Denver.
Yep. Hope. Fingers crossed. Fingers crossed. Thank you so much, Emily, for the update. We appreciate it.
Mm-hmm.
All right. All right. For our STS updates, as I'm sure all of you are aware, updated stat scores were made available for these 9 new procedures that were added for version 3.4.1. Appendix C was updated and posted out on the website. I believe an email notification was sent to the data managers around June 30th. Also, many of you have reached out to me about scores for the 6 procedures that were also added for TOF and DORV. These are procedure harbor codes 3330, 3340, 3410, 3420, 3430, and 3440. I am confirming these scores for these 6 procedures with the task force, and I will have more information regarding the stat scores for these procedures next week. So data managers will be notified when the scores for these 6 procedures are available. So more information will be coming soon, so thank you. Also, as many of you heard on last month's webinar, the STS and IQVIA teams will be offering a direct data entry option for the congenital database. Again, this is coming soon. It is not live at this time, but again, coming soon for congenital heart database. If you would like more information on the upcoming direct data entry option, please email us at stsdb@sts.org. Again, it's stsdb@sts.org, and we'll be happy to give you more information regarding the direct data entry option. Next, I am going to turn things over to Melanie and Joe for our IQVIA update.
Hi, everyone. This is Melanie, and I will introduce Joe. Joe Brower is on our Tier 2 support team. Some of you may have already interacted with Joe. He has been on the calls and listening in, but now he's coming from behind the curtains and will be reviewing upcoming release items that we will be deploying. The list that we are sharing now is for August. So what I will do is turn it over to Joe so he can share those updates, and then I'll come back on and talk about new functionality, update the things that are coming as enhancements. So Joe, if you can go ahead and take it over.
Sure thing. Thanks, Melanie. Hi, everyone. I'm glad to be joining you on these calls. So without further ado, let's get into what is coming up as far as updates that are coming next month. So the first two on the list are in regard to the uploader or the data quality report, STS 3249. So for this issue, the uploader is incorrectly triggering errors when values with decimal points were submitted for the trazolol infusion rate and tranexamic acid infusion rate data elements. And so when the update goes through, those should no longer trigger errors for you. And then that would allow the records to go through successfully. STS 3371. So for this one, the uploader is giving an error for the three fields mentioned there, the major non-cardiac abnormality, other specify, the unlisted gene or chromosomal anomaly specify, and the syndrome other specify. So for those three data elements, the system was catching and saying that the text submitted for those values exceeded our 100-character limit when they truly did not. So we have identified the reason that this is happening, and after the update next month, it should be resolved. The next section has to do with a few issues identified for the missing variable report. So all four of these are all situations where the report is incorrectly displaying data elements as missing when either the data elements weren't applicable in a given situation, or they actually were indeed present on your forms. So for the surgeon NPI, we do have a fix coming that we believe should catch all remaining situations where the surgeon NPI was showing up as missing. There were still a few situations, a few, what's the word I'm looking for? A few configurations where the upload, where the report was catching and still showing these as missing when they were on the forms, and so that should be fixed. The other three were situations, the ICUP unique ID was catching as missing when it was invalid, and the other two, the factor 7A MCG dose 3 and the desmopressin MCG dose 3, for both of those, it was a situation where there was no third dose and it was saying that was missing, and so that should be fixed as well. These issues are currently under review. So the first one here, STS 3356, we're looking into an issue. The user had reported kind of the opposite of the issues before. The status at 365 days after surgery element is not showing up when it should be. So we're looking into that to ensure that that data element is appearing when it should. STS 3225, the autologous transfusion element is appearing on the MVR when it should not be. For this one, it should only apply for certain operation types, but it's showing up for the op types that it should not be. So we're working on a fix for that at this time. STS 3501, this was feedback we received requesting that the dashboard report not count records as missing mortality information if the form indicates that the patient is still in the hospital. And so that is something that will be under review between IQVIA and the STS to potentially make updates to that report to not show missing for patients still in the hospital where it concerns mortality. And the last one there is STS 3389. So this was a bit complicated. So the MVR, it's currently showing that the chromosomal abnormality other specified field is missing. But in the situation that this user had presented, there was nothing entered there, but they had entered a value for the genes with identified abnormality. And so while the chromosomal abnormality specify is actually missing, it shouldn't count as missing because the user had entered the gene information, which in version 3.41 does satisfy that specification. And so we are working to get that updated so that the report no longer flags that as missing data.
Okay, Joe, I can take it from here.
All right.
Thank you
Thanks,
so
Melanie.
much. Thank you. So looking to the future, we actually had this slide from before. It looks like my little images they're hiding, but this is the same slide that we've had before on items that we're working on in regards to priority order. We are working on, of course, getting the information to you via report for case eligibility for inclusion and mortality analysis. That is underway. And then also the primary procedure determination assignment, that is also something that we are currently working on. We do also have to consume the updates that Leanne had presented earlier in regards to those updates and changes regarding the stat score. So just wanted to let you guys know that that is underway. And then of course, once we get to a point, once the harvest is closed and the analysis is done by DCRI, we will be presenting that information within the IQVIA platform as a new report, and you will be able to see your harvest results that will be risk adjusted by DCRI within the IQVIA platform. So that's the latest update there. If we can go to the next slide. So I just wanted to pull two questions that we had from a previous session, a user group. So wanted to also call out, and I'll do a demo so that we can walk through, of course, the reports and just make sure that everyone has information that maybe they were wondering about of how to do certain things within the report. So we'll do that. But one of the questions that has come up a couple of times is in regards to the dashboard, that there are certain items that are missing from the current dashboard, and when will those items be added? So the first dashboard that of course is available now, we do have basically a subset. It's not the entire list of all of the data variables that are available right now. So there are certain sections or variables that are currently not viewable within the dashboard. But we are working with STS to continue to review the priority, and when we will do an update to the dashboard to, of course, include the additional fields and sections. But once we have a timing determination, we of course will be sharing that with the user community, so you know that those updates are coming. So just know that yes, there are certain things that or variables or sections that may be missing. We are aware of that and continuing to make sure that we will enhance the dashboard. Another question that has come up is what happens when the data is updated within the software vendor system and I attempt to upload and encounter a critical error? Okay, and as everyone from previous conversations, everyone may have heard that critical errors, of course, will block the actual record from saving to the database. So if you encounter that, that means that no updates the record has not been added and no updates have been done to any existing records that are in the actual database. And so in that instance, the way to get those updates in would be, of course, to resolve the issue that is being flagged with the critical error. Once the critical error is resolved, you are able to then go ahead and re-upload those files, those records, and then the update to the existing will be applied. So just wanted to make sure that that is clear. Okay, let's go to the next slide. I think it's time for me to shift over to sharing my screen. Yep, it is. So let me take a moment and share my screen. 1 second.
Yep. I stopped share, Melanie, so you should be able to take over.
All right. Let's try this. All right, and you should be able to see it now. Can you see?
Yes, ma'am.
All right, perfect. Okay, so just general workflow of how to get to different reports and just to make sure that everyone is on the same page on just different pieces of functionality. So I'm logged in already, and you'll see that I have the uploader interface that is displaying. And in this upload history window, you will see, of course, your upload submissions. I am in a support test site at the moment, so you'll see a lot of different things that may be listed here that we're reviewing. But just wanted to show you, once you come in, you will see each attempt listed here, each entry. And so in order for me to review that submission report, I would, of course, access the View Reports link that is available on this uploader card. Okay, so I will navigate to the data quality report for this submission using that link. So everyone really should be familiar with that, but I wanted to make sure that I point out another report that's available. We've talked about it before, but I want to make sure that you're aware of it. Of course, once you go into your data quality report, this report is specific to that submission. So that information that you're reviewing is only going to show you the validations that are against those records that are either updated or brand new. If there are records identified as already in the system and there are no changes, that also will be listed and available. Let's just see if this is not the case where I have any records that were identified as already in the database. I'll look to see if I have another example, but if I had a scenario where an upload was done and the system identified records that were already processed and there were no updates to those records, I actually would have an initial entry underneath the alerts by uploaded records that would be record ID 0. And you would see record ID 0, and then source patient ID actually would say no patient ID available, because this entry that we would look at for record ID 0 would be the combination of all records identified as having no changes, and you would just see a total number of those records. And so that is why it doesn't have one specific ID associated with that entry. I'll look to see if I have an example of that so I can give you a real-time visual. But for now, I don't have that scenario with this submission. So of course, if I wanted to populate all of this information, what I would do is just highlight the graph and then it would populate my information. I also have the ability to filter the actual cases. If I want to view only the op type 1 and 2 cases, then I could go ahead and deselect other, and those cases would be removed from my results. Okay, so just wanted to point that out just to make sure that you guys are aware of that. The other thing that you'll notice is down at the bottom, you'll of course have all of those related validation messages. In this instance, I highlighted everything. So that means that I'm going to have both the critical and error messages show down in the bottom portion of the report. In the bottom portion, you'll see that I am also able to review the operation ID, the short name that is triggering that validation message, the actual message itself, the source patient ID, and then if I needed to navigate to that patient record, I have the hyperlink available to be able to get to that specific record. Okay, so again, many have already gone through this, have worked with this, but just want to make sure, just in case we have some that may not have started as yet, and basically are getting into the system, you know, maybe fairly recently. The other thing I wanted to point out is that you're able to access another report, which is called Critical Summary. So you'll see that there's a tab at the very bottom left. If you select that, you'll be brought to another report interface, and here is where you're able to enter in a report time frame. So I'll go ahead and I'll put in 2020 for January. Okay, so January 1st, and then I'll run it all the way through today's date, which is the 17th. And I still can't believe we're already in July. Okay, so After I enter in my date range, you'll have an option that says run report. And here is where you're able to generate a report that is going to give you a list of all of your submissions that you have done. So that first window that you initially will review when logging in, your upload history, all of these submissions, depending again on the time frame that you entered, all of these submissions will be accessible in one single area. And so you're able to, if you wanted to review maybe reports that have passed, only want to focus on those, you'll see that there's a filter option here that's called file status. And if you only want to review items that have passed, you can update this filter by deselecting the failed. If you wanted to, of course, just focus on failed, you can also do that sorting and just focus on failed, right? So just wanted to point out that you have filtering ability there. If you do not see an actual status, for example, of failed, that means that, of course, all of your submissions have passed. This is dynamic. It will only appear if the status is available. Okay, so just wanted to point that out. So here I'll just show you, because we've been asked this question before. If I wanted to see within a submission a total number of records that were included in that submission, and whether or not there were items that failed in that submission, were there any records that were identified as already being in the system and there were no changes, you're able to see that information here. The other thing that we were asked is there a way to see within that actual submission the surgery date, the first surgery date range that was included, and the very last surgery date that was included? So you can see here for this submission that I'm looking at right here, I have the range of January 4th, 2018 was my very first record surgery date, and then the very last is 12/31/2019. Then, of course, file status, total number of records that were included in that submission, 480. And then in regards to successful number of records within this record set, we had only one that actually was added. And then you'll notice that there was a total number of records that did not change, which was 479. Okay, so just wanted to let you know you're able to review that information. And then, of course, if you wanted to go to that data quality report for that specific submission, you have the hyperlink that will navigate you to that report. Okay. The other thing I wanted to point out in regards to if there are any associated critical messages once you select the submission, if there are any critical messages that we need to immediately pay attention to, you'll notice down here in the critical messages section that it will give you that information that an actual record encountered a critical. In this example, the surgery date was the field that encountered the problem. So at this point, you will see the related message for that record. If this is updated, let's say that I went in and I updated this operation ID for that patient and I re-upload, this information would then of course be updated. Okay, so you'll see within that new entry that you would not of course encounter the critical message. So wanted to of course point that out. All right, so that is the data quality report. This is the critical summary report, accessible via the data quality. Let's go ahead and let's navigate over to the operational reports menu. And let's quickly just take a look at what's available in regards to the current reports, starting with missing variable. All right, so the missing variable report, you would of course put in your date entry. I will do 2019. I believe I have some records that I can review. Let's just do 2019 through December. Apply the parameters to generate the report. And here I have a list of all, and you'll see that you have filtering capability. You also are able to see, of course, the date range that you had entered. The filtering capability, it defaults to all variables, but if you wanted to, of course, focus on a different subset, mortality in this instance, you could go ahead and select that filter and it will display those related variables. Right, I'll just bring it back to all. And then you'll notice here where you have operation type. The operation type will, of course, allow you to filter by cases that are identified as operation type 1 or 2. Okay, so operation 1 and 2. And then if you wanted to also see other operation types, you do have that, of course, that will come in by default. But if you did not want to focus on those and include in your results, you would just deselect that option, and that would basically refilter your list automatically. Okay, and then once in the report, in order for you to, of course, review the items that are flagged as missing, you would just select the cell. So let's just say that I select this one here. It will show the results down below, and you're able to, of course, navigate to those actual cases in order to see the fields that are being referenced. So I'm going to take a look at, I'll do anesthesia because I know exactly where this field is. Let's just use one of these. I'll navigate to that form. Another note, if you are not collecting anesthesia data, there is a setting within your participant site that is set by the STS to indicate whether or not the site is collecting for anesthesia. If that is not selected for the MVR, right? The MVR will look at that logic. If that is not selected, anesthesia variables will not display. So just wanted to make sure that that was clear, that you will not see anesthesia related variables if it is set within your site that you are not collecting anesthesia. Okay. For the DQR, when the submission is occurring, you will see related validation messages, errors, warnings, critical errors. You will see those on the DQR because any data that's coming in initially will be validated. So you will see messages related to anesthesia, and that is not dependent on the setting for the participant site. Okay, that is just the initial coming through the door, it's validated. All right, so going to the form, I want to go to the anesthesia. This one was flagged as the anesthesia field as being missing. So you'll see that that is the case. It is missing. This site is, of course, set up to collect anesthesia. So in this example, that is why it is being flagged. The other thing that I wanted to point out, when you're in the actual case form and you're working through errors and or reviewing at this point errors and warnings, you are able to take a look at the list of all associated errors and warnings that are available. I just wanted to point this out since we're already in here. You'll notice that we do have a warning that is currently showing. And if I were to select this actual warning, it will bring me to the section related to the 365. So it brought me to the section within the case form for that, that variable. So that is applicable for any warnings and errors that appear within this task list. And again, I got to that by selecting this, this clipboard with a check mark. And again, it will show all of the related errors and warnings. All right, so I'm going to close this. And that basically is the, just, I'm looking at time, want to make sure that we have enough time to address any questions. So that is the missing variable report. So we will go back to operational reports. And let's go ahead and take a look at, I'm going to go to the harvest report first, and then we'll come back to the dashboard. But let's go to the harvest summary report. And for the harvest summary, this is presenting you with information related to real-time errors and warnings that are available on the records based on the surgery date range that you entered. So if you want to see a holistic view of all of the errors and warnings that are currently on your records, you would use this report to review that information. Okay, with the DQR, it's a little bit different where, again, it's doing validation per submission. This report will allow you to enter in whatever time frame you would like to review, and it's going to pull back those records and give you the current state of what those validations are. So let's take a look. We'll do 2019 again. Okay, 2019 to 20, yep, let's do that one. And it will give us, let's see, here we go. First thing I want to point out is, again, if you are not working through any cases that are not identified as OP type 1 and 2, we do have this filter where you would just deselect that, and it will update the results to only display cases that are identified as OP type 1 and 2. All right, so I'll just to make sure that you're all aware of that filtering. Same functionality where if you were to click and hold, and it's left click and hold, and of course shade over the pie chart, it will automatically select all of the errors, warnings here. So, and then by doing that, it populates all of the messages down in the bottom portion. So again, similar to what you're working with in the DQR. Okay, I do want to point out, because this always comes up and this is something that we are aware of, is that even though that there is a value that is showing here, this value actually we will be updating. There is no records that are associated with the category of no validations outstanding. There are no validations. So if I were to select this one is deceiving, unfortunately. But we understand, we want to make that update, but just know that that is just a placeholder. And so this is just letting you know that on this specific record, there is no outstanding information or warnings or errors that you would need to address. Hence why it's blank down the bottom portion. Okay, so really the items that will have associated messages will be for the errors and of course warnings. So let me just bring that back. And here you'll see error, and it has 1. This is truly that this has 1. And same, if you were to scroll down, if there are more than 1, you will see that the number will increase. Okay, it will be a 2 or it'll be a 3, whatever, however many warnings that are available. I need to see, why is this not, yep, I gotta go back. Let me deselect and do that. It should bring up everything. I have to go and look. Okay, so the way that you would, of course, in any of these reports, export this information, these reports, for you to be able to take a look at it, maybe in Excel or another spreadsheet program. Of course, you would just use the option to export using the Microsoft Excel export. And all I did was just right click on this section so that it brought up this menu. Okay, and once you do that, you do have the option for Excel, but if you're using another type of program, maybe Google Sheets or some other Excel type program, you do have an option for export table, and that will allow you to export to that other type of spreadsheet program. Okay, so I will stop here on this report. I will take a look at the dashboard. Let's go ahead and take a look there. And make sure that we have more than enough time to get through questions. All right, so time period, you do have the option, of course, to select a predefined time period, or you can enter in a specific date range. I'll go ahead and select the option for 2016 through 2019. Next, you have another option for procedures. You can actually sort or filter by stat category or by procedures. You cannot select both. You'll notice that if I come here and I try to select, it's not going to allow me to select both. So you're able to deselect and of course select all procedures if you want to focus on that. Then you have age. Next, once you select in that field, it will give you the options here by age group. I'll select all. And you'll notice that once I selected all here, the age and days, it disabled the field for you to enter here. So again, if you needed to just do age and days, you would make sure that this is not selected and you can go ahead and enter in age and days for that filter. So I'll go ahead and select all. Next is the index operation. If I only want to focus on my index operations, I can go ahead and select yes. If I wanted to see all, then I would of course select no. I'll go ahead and select yes for this example. Once you've entered in your criteria, you would then just hit apply parameters and then the report will generate. And so just know that when the report is generating, we do have the different sections that appear underneath the select report section. And those are individual reports that are basically generating and pulling the data. So that's at this point, we're waiting to see that these sections get populated. But that's usually when you're thinking about the processing, it's actually pulling in those individual reports that you see here. So in my example, it looks like I'm in this test account, so it's not giving me cases. I may have to go back and change some parameters. Let me just do that and see, because I'm really not sure based on this test site what kind of data I have. Let's try it one more time. And so once I am able to generate that information, I know main question that has come up a couple of times has been related to the mortality and how am I able to see counts for the op type. That information is available within the dashboard for you to review. All right, so I'm just going to go to the sections. I guess I don't have anything that's pulling in, again, test site, so that may be the case, not sure why. So taking a look at the common question related to the mortality, I just wanted to, of course, show the sections where you're able to review that mortality status at hospital discharge. You'll, of course, have your total number related to the responses for each of those sections. Let me just scroll down. This is where we're updating logic for operative mortality. So Joe raised this earlier today with his report where we're looking at making sure that the calculation is not counting patients that are flagged as still being in the hospital as missing. Okay, so that is something that we're aware of and we will be updating. So if you're encountering that and seeing that you do have a case or multiple cases that are being counted there, but the patient is in hospital, we are updating the logic. Currently, it is only looking at just the variable and the response. And of course, if the response is not there, it's just flagging it as missing. So just wanted to, again, make sure that everyone is aware of that. The other question that comes up is related to how do we see the op types. So let me just scroll up. Within the operative section of the report, there is the variable for operation type. So you're able to see your counts by op type in this section of the report, and you're able to review those counts here. Okay, so just so you're aware. And then of course, when you're reviewing this, a lot of times, especially if you're not reviewing this on your monitor, on a large monitor, if you're maybe using your laptop, you're able to resize just this section if you wanted to review just the details within this section. And the way you would do that is maximize the visualization. So all I did was right click and chose that option for maximize, and you'll see that you're able to then just display this section of the report so that you have a better view. Another thing I wanted to point out is that you're able to right click on this tab that is right at the bottom, left-hand side, you'll see that it's CHSD Participant Dashboard Report. If you right-click on this, you will have an option that says Open Page in New Window. So once you select that, it will allow you to then take up more real estate on your browser. It opens up another tab and you're able to review that. And you'll notice here at the very top, hopefully you can get to see that, there are arrows, and you'll see that there's another double arrow that says Restore Visualization Layout. This will basically bring it back to the previous view. And then of course, here is the next arrow. So these will allow you to move through each component in the actual report. So if I were to select, let's go back to a previous section where you're able to see, it will bring you to the different components in the dashboard. But if I need to resize, then that is where you're able to bring it back to the previous layout. So maybe, I'm trying to think, I've probably showed this before, but I always want to make sure that you all know some of these tips and tricks of even the display aspects of using the report. Okay, so I think I've gone over way long, and hopefully we can get through questions. So apologize, but want to make sure everybody gets this info.
Melanie, that was great. Thank you very much. I think I think we'll be fine on time, but that was an excellent overall overview and review. So thank you very much. That was very useful.
You're welcome. So I'm going to leave it here because sometimes we need to navigate back and forth. So unless we need to, we probably need to go through the rest of the slides. Let me not be greedy. Hold on. Let's just have you finish up.
Okay, I'll finish up and then we'll just keep that open and then you can reshare afterwards if
Will
needed.
do.
Okay. All right. All right, so you should be able to see my screen.
Yep, I can see it.
Oh, all right, perfect. All right, we'll scoot through the rest of these slides quickly. No new information here. You all have seen this information before. Again, the IQVIA support plan slide for questions related to DQR, harvest summary, our harvest submissions, operational reports, please reach out to IQVIA at ststechsupport@iqvia.com or call their 1-833-256-7187 number for live in-person support. Their live support is available 8 a.m. to 8 p.m. Eastern Time, Monday through Friday. When you do contact tech support, please ensure that you're issued a ticket number. That's extremely helpful, actually, when we're doing the user group calls or even on these webinars today. If you could always, if you have a specific issue, if you've already submitted a ticket number, if you could please provide that, typically an RITN number, if you could supply that in your question, that would be helpful so we could track. As usual, if Tier 1 is unable to answer your question, they will route to Tier 2 IQVIA support or STS accordingly. And then again, Tier 2 would work directly with a vendor if necessary, and then STS would work with DCRI if there were analysis-based questions, and we would follow up accordingly. Also, just to bring to your attention, we've had a couple of issues, and we've been finding that some participants have reached out to tech support and stating they haven't received responses. We've gone back and looked, and it seems that in some of these cases, the tech support emails have been going to the participants' junk or spam folder. So just a friendly reminder to please check your junk or spam. If you have submitted a ticket request via support, if you submitted a question, you haven't gotten a response back within 2 business days, again, please just check your spam or junk folder. If it's been longer and you have not gotten a response, please feel free to reach out again. I just wanted to point that out. Again, here is a slide of our resources available to you for support. We have our STS National Database page, IQVIA support information. We have our STS National Database feedback form, and then, of course, just a brief bulleted listing of our resource documents that are available out on the STS National Database webpage. As always, if you have any questions, please do not hesitate to reach out to me directly. Here is my direct email and phone number. Also, if you have STS database operational questions regarding your participation agreement, direct data entry, availability options. You have questions regarding payments, any general question, you can also feel free to email us at stsdb@sts.org. Before we get started in our Q&A, I just wanted to cover the dates for our next calls really quickly. Our next user group call will be on next Friday, a week from today, July 24th at 11 a.m. Central. And then our next monthly webinar is scheduled for August 21st at 12 p.m. Central. So be sure to mark your calendars again for July 24th for our user group call. And again, our monthly webinar on August 21st. All righty, we've got about 10 minutes left, so we're going to turn things over to the Q&A. Again, we'll get through as many questions as possible. If you are submitting a question, if you've submitted a question via tech support, if you do have your ticket number, if you could please include that in your question. Again, it will help Melanie and the support members on the call to track down your request, so that would be super helpful. So if the team's ready, we'll get started with our questions.
Ready.
All righty. Our first question looks like, Melanie, this one's for you guys. Any update on the vendor ID too long error for harvesting to IQVIA?
I actually needed more information on that. That's not familiar to me,
okay.
Unless Joe or Joe may have some insight, but that one, I think we need, of course, a ticket to be able to get more details.
I agree.
All right.
Okay, thanks.
All right. So Heidi, if you have a ticket number, if you could please send that, and if you have not submitted a ticket for that, please do so. Submit a request for support. Our next question, I do not see the content on the website for 2020, only 2019. Can you show me how to navigate to that site for the AQO event for 2020? Absolutely. Also in the chat box, you can access that. I do see that Emily did put a link to the AQO information, but I am also happy to pull up the website really quickly. Here, let me do that. Let me move the screen over. So here on the STS webpage, if you go to meetings and click on calendar of events, and here you'll see the link for Advances in Quality and Outcomes, a data managers meeting. So just click here on the Advances in Quality Outcomes link, and that'll take you to our AQO information. All right. Our next question is the missing variable report supposed to include all the variables that are in the STS form?
That are missing, that are considered missing. So it's not going to give you a full list of everything. It's only identifying the fields that are missing. So if those other values has data, then it's not going to show up on the report.
Great. Thank you, Melanie. Our next question, I uploaded 598 records and my case upload displayed 598 out of 598. Next upload was only 2 records, yet case upload displayed 353 out of 353. Called support, they weren't able to explain, have not received any additional follow-up.
Kelly, if you can provide, sorry, go ahead.
This is Jeanette. I'm familiar with this issue. Kelly, we are looking into this one, and we are actively investigating it. So we'll need a little bit more time to get back to you there.
Great. Thank you, Jeanette. Thank you, Melanie. Our next question, can we fix the error directly through IQVIA or should we do it through our vendor?
You will do that through your vendor. All changes will have to be done via your vendor, and once you re-export that file, you would then update the IQVIA system with that secondary upload. So all changes are done through your vendor.
All right, thank you, Melanie. I submitted a request that I'm unable to, on 7/8, that I'm unable to review any data in the critical summary report. I've not received any follow-up, tried various date ranges in the submission filters and not seeing any data displaying in the critical summary report. I don't know, Jeanette, if you all are aware of that and are actively working with Kelly on that one.
That one's not familiar, but if we have a ticket, yeah, that one's not. I actually went in because I saw her message earlier and I I'm able to run and it's giving me results. So we would just need, like, we can get that ticket number, Kelly. That'll be helpful.
Thank you. And again, the ticket number, you should be issued a IQVIA ticket, and it should start with a RITM and information, and then be followed by some numbers. So our next question, who do we need to contact to specify that we are collecting anesthesia data to enable that flag for our site? Peter, if you all are collecting anesthesia data, you have not yet signed a anesthesia participation agreement, if you could reach out to us at stsdb@sts.org, and our STS team will be happy to get more information for you regarding the anesthesia agreement and steps needed to initiate an anesthesia contract to submit anesthesia data. And again, that's stsdb@sts.org. Our next question, can there be a dashboard to answer the U.S. News questions for 2019, anticipating their request coming December? And would be nice to know where we can find the answers. Hi, Nancy. Not at this time. We're not planning on doing any type of report specifically for U.S. News. STS doesn't have any say on those questions or any affiliation with that, so we would not be creating any dashboard report specific for U.S. News. I don't know, Carol, if you had anything you wanted to add to that.
No, I think you got it.
Might be on mute.
We don't have a relationship with U.S. News in that way any longer.
Right. All right. For our next question, let's see. For version 3.3, I have several operations indicating missing items on anesthesia that are not actually missing. I'm researching. It seems as though the records did not have an anesthesiologist present. And Melanie, I think you all were addressing this for 3.3.
So this is operation not missing. Yes, we are. Yeah, we are having to address this one. I thought I had it on the list, but maybe I didn't. I apologize.
I thought you did. Okay.
Yeah, let me just double check on that. But
okay.
Yeah, that's specific to 3.3. We understand that there is, for the missing variable report, it is reporting items as missing because of the anesthesiologist present not being taken in consideration, the response there. Let me find that ID and update the group. We can go to the next one.
Thank you, Melanie. Yep. Here we have a suggestion. Can we have a full session similar to what data managers want to know? This way there is more time available for managers to ask questions. Absolutely, Heidi, and we have the user group call on Friday, so absolutely, we'll use that time to answer more data manager questions. Today, this is more of our monthly webinar where we do cover more topics, but our user group calls are designed specifically to spend more time with the users and allow a lot more time, have more time allotted for questions. But absolutely, that's a great suggestion, so thank you, Heidi. Our next, here, Autumn has supplied a ticket number. She says, submitted a ticket without response, and then she provided her ticket number. Melanie, Jeanette, Michelle.
Okay,
I'll just leave that there so you guys can.
Yes, thanks.
Okay, no problem. It looks like we have 3 ticket numbers in a row. So again, from Ruthie, submitted issue to Tier 1, received a response, letting her know it was escalated to Tier 2, but she's waiting response from Tier 2, and then she supplied her ticket number as well. Oh, and Heidi has provided her ticket number for the vendor ID too long. So I'll leave those there so you guys can reference those numbers. Our next question, currently we are submitting data for spring 2020, 16 through 19, 2016 through 2019 cases. Wanted to inquire, are we allowed to submit 2020 data, which will be part of the fall 2020 harvest, spring 2021 harvest? Yes, absolutely. You can submit data up through today's date. Surgery dates from today's date if possible, if you wanted. So absolutely, you can submit data up through today's date with the surgery date. So absolutely. And did I miss when harvest close will be? So no, Heidi, STS has not yet announced when the harvest close will be. We have another task force call at the end of this month. So this will be a topic of discussion for our STS congenital database task force meeting this month. We have not established a harvest close date, but this will be a topic of discussion. And as soon as that date is determined, we will let you all know. Again, participants will have at least 4 weeks notice before the harvest close date. So just know that, it's going to be, the harvest is going to be open for a while. It's not, we're not planning on closing it, say, next month or anything. So just know we're giving you all plenty of time to get used to the dashboard. We still are in the process of building out the primary procedure determination reports. So there is still a lot of ongoing work. So yes, you guys will have ample time to get your data in and cleaned up and harvested. So, and you're very welcome. Thank you. I don't have any other questions at this time. I see we're a couple minutes over past the hour. And Heidi has one more question. Is September harvest going to keep the same date? Again, Heidi, the spring and fall harvest dates are something that we're going to be talking about with the task force in our monthly meeting at the end of this month. So I can't say yes or no at this time. I just really don't know. So it is going to be a topic of conversation. So we will update everyone as soon as we have that call at the end of this month. So more information to come. I don't have any other questions. I don't know. I know Melanie and team have gotten the ticket numbers from Autumn and Ruthie and Heidi, and I know they'll be following up with you guys individually. I don't have any other questions coming in. Does anyone from the team have any other information that they'd like to add before we call it a weekend?
I'll follow up on that item regarding anesthesia. Still looking for that one there. Yep.
Okay. And again, and that was for version 3.3. So,
correct.
And I know, Melanie, we had talked about that earlier, and you had indicated that that was being addressed. So, all right. I still don't see any other questions. I've got about 3 minutes after the hour. I want to be respectful of everyone's time. I just wanted to take an opportunity to thank everyone for joining today. And again, just throwing up the dates for our next call. We have our user group call on Friday, the 24th at 11 Central, and our next monthly webinar on August 21st at 12 p.m. Central. So I'll just take this opportunity to thank the team for joining me today and for your support. And I hope you all have a great weekend, and we'll reconvene next Friday on the user group call. Thank you, everyone. I hope you all have a great weekend.
Thanks, Leanne. Have a good weekend, everybody.
Thanks, team.
Melanie and Joe.
Thank you.
And Jeanette.
Thanks, team.
Everybody. Bye.